Good morning all. Today we are going to see about urinary tract infection in pregnancy. So we all know that during the time of pregnancy, due to some anatomical and physiological changes, we will be having some signs and symptoms that is very common and natural. But in case if those signs and symptoms, for example, in urinary tract infection, you can compare like we will be having the symptoms of frequency in urination, sometimes feeling means incontinence in urination like that. So normally during in the time of third trimester, this frequency in urination is common, but even though it is a symptom of UTI. So this is what we are going to see, like, so how the urinary tract infection will be in during the pregnancy, how it will cause disturbances or it will cause any unwanted problem to the antenatal mother. So this is what the thing we are going to discuss about, and what will be the management that we can do for urinary tract infection that occurs during the time of pregnancy. So this is Bhavani, tutor, Department of Obstetric and Gynecological Department, Triple M College of Nursing, Chennai. So objectives, at the end of class, the student will be able to define urinary tract infection, explain etiological factors and risk factors of urinary tract infection, explain pathophysiology of UTI, and describe about clinical manifestation of UTI, enumerate the pathogenesis of urinary tract infection, that is how it occurs, and explain the diagnosis of urinary tract infection, how we can find it out, and explain the medical management of urinary tract infection, and to understand nursing management of urinary tract infection. These are all the content we will be covering in the PPT. In introduction, the urinary tract infection is a bacterial infection in part of the urinary tract. When it affects the lower urinary tract, it is known as simple cystitis. That is a bladder infection. Bladder is the lowest part that is located at the urinary tract, right? So when it affects the lower urinary tract, it is a simple cystitis, that is bladder infection. And urinary tract infection, UTI, when it affects the upper urinary tract, it is known as pyelonephritis, that is kidney function. Upper we can say the kidney, so that is a kidney function. And UTI is 50 times more common in women, with about 5% per year developing symptoms. UTI is uncommon in men below 60 years of age, but the frequency is similar in men and women in during the time of old age groups. Definition: UTI is an infection involving the kidney, ureter, bladder or urethra. These are the structures that urine passes through before being eliminated from the body. So etiology, that is causes: E. coli, that is the most common cause, and Klebsiella proteus, Staphylococcus saprophyticus, and the mainly it will be caused by colonic bacteria. Transmission, that is how it spreads, like female how for those who will get affected, like female, uncircumcised male, vesico-urethral reflex, toilet training during the time, and voidal dysfunction, pregnancy, obstructive uropathy, urethral instrumentation, any diagnostic procedures done, and wiping from back to front during the time of caregiving, and bubble bath, tight underwear, sexual activity, pinworm infestation, constipation, fimbriated bacteria, anatomic abnormality, neuropathetic bladder. Pathophysiology of UTI. The urinary tract above the urethra is normally sterile, usually it will be. Several mechanical and physiological defense mechanisms include normal voiding with complete emptying of the bladder, uretrovesical junction competence, and peristaltic activity that propels the urine towards the bladder. This is the normal activity. Antibacterial characteristics of urine are manifested by an acidic pH will be less than 6, high urea concentration, and abundant glycoprotein that interfere with the growth of bacteria. These defense mechanisms assist in maintaining sterility and preventing the UTI. Normally, this is the function will occur in order to prevent the UTI. Clinical manifestation: acute pyelonephritis, cystitis that we have already discussed, and asymptomatic bacteriuria is there. In acute pyelonephritis, that is what I said, like kidney involvement of renal parenchyma characterized by fever, abdominal pain or flank pain, malaise and diarrhea. And cystitis involves bladder and symptoms of dysuria, urgency, frequency, suprapubic pain, incontinence and malacerous urine. No fever and does not result in renal injury because this is a lower urinary tract. And asymptomatic bacteria, urine culture, positive urine culture without any manifestation of infection occurs exclusively in girls, benign and does not cause any renal injury. Next comes the diagnosis. So how we will find out, like urine analysis, that is more than 10 count will be WBC in a centrifuged urinary sediment. Hematuria, negative or positive nitrite test. Absence of pyuria does not rule out UTI. And in urine culture, gold standard midstream urine sample, more than 1 lakh colonies per ml of single pathogen and 10,000 colonies per ml if symptomatic. Catheterized urine, more than 1 lakh colony count. Suprapubic aspirate will gives you the presence of bacteria. Diagnostic evaluation, radiological evaluation. So the guidelines for the selection of patients with UTI for radiological evaluation is all neonates with first UTI and all males with first UTI at any age, all patients with recurrent UTI, all patients with pyelonephritis. And intravenous pyelography can be done for in order to get the information about renal size, renal scar and the state of pelvocalcial system. Next comes the voiding cystourethrogram, definitive test to document the voiding cystourethrogram indicated in children younger than 5 years with UTI and any child with febrile UTI, school-aged girls who had 2 or more UTIs, any male with UTI. Next, ultrasound of the kidney and urinary bladder that should be obtained to rule out hydronephrosis and renal or perineal abscess. Medical management. Management of UTIs typically involves pharmacologic therapy and patient education. The nurse teaches the patient about medication regimens and infection prevention measures. So this is what the medical management. We can give the pharmacological therapy and patient education. Also the nurse can teach the patient about medications and how they can prevent the infection in future. Acute pharmacological therapy, uncomplicated cases, single dose of administration, short course 3 to 4 days regimens or 7 to 10 days regimen. The antibacterial agent should be affordable and should have few adverse effects. Most cases are cured after 3 days of treatment as it is in pregnancy. In case of complicated cases, we can administer cephalosporin or ampicillin for 7 to 10 days for the treatment to be effective. Trimethoprim or sulfamethoxazole, commonly used medicine. Ciprofloxacin, that is fluoroquinolone, and levofloxacin, that is fluoroquinolone. It is often used as a first line drug because E. coli has developed the resistance to ampicillin and amoxicillin. And it is another fluoroquinolone is a good choice for short term therapy for uncomplicated mild to moderate UTIs. And nitrofurantoin, it should not be used in patients with renal insufficiency because it is ineffective at glomerular filtration rate of less than 50 ml per minute and may cause peripheral neuropathy. And phenazopyridine, it is urinary analgesic, may be prescribed to relieve the discomfort associated with the infection. Long-term pharmacological therapy. Relapse of UTIs suggest that the source of bacteria may be upper urinary tract or initial treatment was inadequate or administered for a very short time of period. That is why because the UTI has been occurred recurrent or relapsed. And women with recurrent UTI with symptoms of fever or number of treatment episodes exceeds 4 in a 6-month period to contact the healthcare provider. Patient education do's and don'ts. Do not delay urination when it is necessary. A high fluid intake is essential. Cleaning the urethral meatus after intercourse with an antiseptic or placebo ointment. Drinking 250 to 500 ml of cranberry juice daily. Long course of low dose antibiotics at night to help prevent recurring cystitis. So how can we treat an urinary tract infection during pregnancy? So you should follow good bathroom habits, drink more water, and apple cider vinegar can be taken, cranberry juice, Greek yogurt, and warm compress can be given in case of pain. And nursing management, so you should assess first. Like history of signs and symptoms related to UTI is obtained from the patient with suspected UTI. The presence of pain, frequency, urgency, and hesitancy and changes in urine are assessed, documented, and reported. Patients' knowledge about prescribed antibacterial medications and preventive healthcare measures to be assessed. So these are all the things we should assess first. And diagnosis like acute pain related to infection within the urinary tract as manifested by pain or urination, suprapubic pain and bladder spasm, impaired urinary elimination related to UTIs as manifested by urgency, frequency, incontinence or hematuria, and verbalization of concern over altered elimination pattern. Hypothermia related to infection as manifested by elevation in temperature, tachycardia, chills and malaise. Risk for reinfection, that is relapse related to lack of knowledge regarding measures to prevent the recurrence. Concluding the part, urinary tract infection is more common in pregnancy. Asymptomatic bacteria should be treated because there is significant risk of acute pyelonephritis. Acute pyelonephritis increases the risk of premature labor. Acute pyelonephritis should be managed in hospital with IV antibiotics. That can be managed with IV antibiotics. As the UTI is more common in pregnancy, so in case of asymptomatic bacteria, that can be treated with a very less risk, and acute pyelonephritis increases the risk of premature labor. So it is important to treat the UTI as early as possible. And this comes the reference DC Datta, Anama Jacob, Miles, and Loader Milk, Perry and Bobak. So thank you. So far we have discussed about the definition, what are the causes, how it spreads, the pathogenesis, and what can be the diagnostic evaluation and clinical manifestation, what type and management, what type of antibiotics can give given and how long it should be given, and what are the types of UTI, like which part can be lower urinary tract causes cystitis, and upper urinary tract infection causes pyelonephritis. So these are all the, and along with that, nursing management, nursing diagnosis we have discussed, and how to do nursing assessment for the patient with urinary tract infection. So far I think we have clear about the urinary tract infection during pregnancy can be managed, and it should be managed as because we have seen in the conclusion that it may cause a premature labor. So in order to prevent those complications in pregnancy, we need to rectify the minor ailments or minor illness. So thank you.